If we want real and sustainable solutions applied to some of the problems facing our burdened healthcare system, we need a paradigm shift in our thinking. We need game-changing ideas brought to the table for discussion. Game changers such as self-scheduling for provincial health employees, or how about you access your primary care provider through a neighborhood nursing station? Those would be game-changing ideas. On the therapeutics, what if cannabis was seen as a medicine throughout the entire healthcare system? Game-changing idea. That would require us to reassess and rethink how people access their medicines, and also how we distribute medications, especially those substances that are misused. We need to apply evidence to our thinking, and people are going to say we don't have enough studies for cannabis to be seen as a medicine. But we have evidence on cannabis benefiting people with pain. It has evidence of people benefiting from cannabis in seizure control, and we have evidence of cannabis helping people with nausea. These are just some of the benefits that people use cannabis for. As a healthcare provider, I've been told to prepare for cannabis to be a misused substance. So let's look at cannabis as a misused substance, and let's look at it through the lens of risk management and compare it to other substances that the healthcare system deals with. Alcohol. A man my size consuming 1.5 liters of Scotland's best single malt definitely misused the substance, but if left alone will likely die of aspiration or respiratory system impairment. Tylenol. A man my size consuming a half a bottle of extra strength Tylenol, a readily available over-the-counter analgesic, has definitely misused that substance. And if not given the right antidote in the right time period, will likely die a slow and painful death. It's been calculated that a man my size would need to inhale 650 kilograms of cannabis in a 15-minute period of time to be seen as overdosing and dying from cannabinoid poisoning. That is a fantastical number, because more than likely I would have died of smoke inhalation, but it's still a ridiculous number. So let's use some numbers that we're more comfortable understanding, such as the Canadian government says that 76% of us consume alcohol. 20% will misuse it. 47,000 deaths a year attributed to alcohol misuse in Canada. Tylenol. It's the leading cause of liver failure in Canada, and it attributed to 4,500 hospitalizations due to Tylenol misuse. Cannabis. Canadian government tells us that 27% of us have consumed it and 9% will misuse it. And the Public Health Agency of Canada says that between 2010 and 2020, cannabis represented 1% of the hospitalizations seen due to substance misuse. So when we look at cannabis as risk management, we have enough evidence to know that as we practice and do the studies that we need to do, people are not going to die from cannabis from misuse. You want a ridiculous number? The American Drug Enforcement Agency stated that 1 kilogram of fentanyl has the potential of killing 500,000 people. You want a fantastical paradigm shift in pulp culture? Consider this. What if fentanyl was the drug of choice rather than cannabis at Woodstock 69? Now that would have been a game changer. I am Kirk Nyquist. I'm a registered nurse in Dauphin, Manitoba, Canada, and I think cannabis is misunderstood. If you want to learn more about cannabis, tune into our webpage, ReeferMEDness, the podcast, found at ReeferMED.ca. That is ReeferMED.ca. You should check us out.